This is a case of closed spina bifida in 26 weeks pregnancy. Closed spina bifida are frequently missed in routine scan because we don't see any cranial abnormalities. Here you can see that this cerebellum is well visualized, and there is well visualized cisterna magna, and there is no hydrocephalus also in the transverse view, and everything is normal because there is no any herniation of the spinal fluid and the meninges, and the skin over the back is intact always in spina bifida. But if you scan from this cervical to this thoracic and lumbar and sacral region, you see that the skin is intact everywhere. There is no herniation of the uh, spinal cord and the meninges, but here in the lower lumbosacral region, you can see there is some malalignment of the elements of the vertebra. There is no proper arrangement. The arrangement is distorted in this lumbosacral region, and this is the mid sagittal view, and the skin over this area lumbosacral region is also intact. But if we scan from the coronal plane, then we can see that there is a fusiform dilatation over here, and there is absence of the spinal element in this lumbosacral vertebra. You can see this spine. This is the vertebral spine in the midline, and there is a defect over here, round structure. This is a closed spina bifida case here, yes, and there is fusiform dilatation of the spinal canal here, yes, very clearly. You can see the spinal elements are missing in the posterior part. In this coronal view is the best view to evaluate the closed spina bifida. Also sagittal also, but in coronal view you can see the fusiform dilatation of the spinal canal. Yes, here you see there is dilatation over here, and further this spine of the vertebra are visualized again in the sacral region. Yes, this there is absence of the spinal element over here, and these spinal elements are also not clearly well uh, well aligned. You can see here there are dots, and here it becomes a vertical or oblique line. So these elements are also somewhat malaligned, and yes, here is the fusiform dilatation of the spinal canal once again. So this is a case of spina bifida, no herniation of the spinal cord or the meninges, and this is the mid sagittal plane. There is tapering also, so you have to look very meticulously in this type of case, otherwise it is very there is high chance to miss, and there is associated left side pleural effusion also. This is stomach, and this is aorta, and this pleural effusion is more on right side, so this is left side, so this is left side pleural effusion. It is not ascites because this abdominal content, this liver and all these things are located below this fluid, so this is the thoracic cavity, which is showing fluid inside, and it is rest of the anomalies are not seen. Sorry, rest of there are no any positive finding in rest of the areas. And yes, here in transverse view you see three dots, but in lumbosacral region you will see something is missing. Some of the elements they are missing in spina bifida. You have to trace this whole spinal canal in transverse view also.